Hi, Dr. Shaw. This is Tatiana Rivera. I'm doing my first video blog to you for week 2 about a prejudice that we have. And I'm actually a little ashamed to say that after watching your integrity lecture and the YouTube videos that you posted, that I do have a couple little social stigmas. I wouldn't call them prejudices per se because I don't have any hatred or hostility towards any particular group of people, and I don't treat them any differently. I guess it's more of just mental judgments and preconceived notions before I actually get to know the person. So that is something I really have to work on. I work at a PT clinic, and I treat every patient that I work with, I treat them the exact same, regardless of age, gender, sexual orientation, ethnicity, anything like that. I treat them the exact same as I would treat anybody else. I'm happy, I'm upbeat, I'm very positive, and I interact with them during their treatment. But when I see a certain group of people walk into the clinic, either if the patient, for example, the patient is overweight or obese, I kind of have that mental thinking of, great, this person's rehab might take a while. They're going to be lazy, non-compliant with appointments, complacent. They just won't care and just show up whenever they want, type of thing. And about 8 times out of 10, I'm proven wrong. So I'm glad to say that. These patients are not lazy at all. They're not complacent. They want to get better. They're at rehab, for more than just the reason that their doctor said just go to rehab, because for either rehabbing their a total knee or total hip, shoulder, anything like that. And they get frustrated as well, when they don't see that they are not at a certain point of what they want to be at. They get frustrated, and in a way I kind of like seeing that, because I like to see that they are determined, and so I have to get that out of my head to stop making those preconceived notions of, well, physically they look like this, so that means they're going to act this way, and I need to not do that, because obviously that's not true. One thing that I actually do have a big problem with, and this is actually speaking from a minority's perspective, is people who come into this country and they have lived in the States for a number of years even, and they kind of don't want to speak the English language. They are kind of just settling in. Either I speak Spanish or I speak French, and I'm only going to speak these languages. I'm not going to attempt to speak English. You have to cater to me in order to, communicate with me, whatever it may be. I actually kind of have a problem with that. Whenever I go visit my family in Puerto Rico, luckily I am bilingual, so I always attempt to speak in Spanish first. If someone sees that I'm kind of struggling with something, then they'll help me out and they'll talk to me in English. And I totally respect that. And I kind of wish that we had that same mutual respect of, people who come here into this country, to at least attempt and try to speak English first. If we see that they're having a problem, then, we'll help them out, as best we can if we don't speak their language. Once again, I see this at my clinic as well. I have those Spanish-speaking patients who come in and don't, they just look at you as if you have 4 heads, and they just don't bother to make an attempt, and I feel like sometimes I wonder if they have tried before in the past, and they've been here, that they've been made fun of, and so they get discouraged, and so they just kind of give up in a way. And then so they just look for other ways to communicate with people and not really speak English. So, that's something that I have a little bit of a problem with, and I guess something that I can work on with that is to not have such a negative connotation about it. That there are ways to go around it. We always find ways to help that person out. If they are Spanish speaking, I do end up speaking to them in Spanish, but I kind of would at least like to see an attempt for them to try and speak a couple words of English to us. But so those are my stigmas, my prejudices that I have, and that's it. Thank you.